So far in our discussion of drugs that affect homeostasis, we've focused on clotting factors. Take heparin, for example. It binds antithrombin to inactivate thrombin in factor 10. In warfarin, all it does is prevent reactivation of vitamin K so that you can't produce those vitamin K-dependent coagulation factors 2, 7, 9, and 10. Normally, these circulating proteins interact in a series of proteolytic reactions, culminating in the conversion of fibrinogen to fibrin, which forms an insoluble mesh, and your blood is clotted. Well, almost. It turns out that we've only been focusing on half the story because a parallel process is already underway involving the activation of platelets. You see, when endothelium is damaged, platelets get activated. When platelets get activated, they get all sticky-like. When platelets get all sticky-like, they form a platelet plug. One of the jobs of the fibrin meshwork is to stabilize this plug. And there you have it, a blood clot. That is, unless you throw in one of our next drugs, the antiplatelet agents. You know, all this talk about platelets is reminding me of Little League, of course. Standing over the home plate, choking up on that bat. You know what they used to call me back then? The Ice Queen. Haha, yeah. Probably because I would stare that pitcher down with my icy glare. Mostly from the bench, as I handed out iced refreshments. It's an important job. The endothelial cell layer lining blood vessels usually has an anticoagulant phenotype. In other words, platelets and clotting factors don't really adhere to it. They just keep circulating around as usual. Damage that vessel, though, and all of a sudden you've got a potent procoagulant surface. Specifically, collagen and von Willebrand factor get exposed, resulting in platelet adherence and activation. This will be depicted at the backstop behind the baseball diamond. Think of this weathered and peeling wall as a damaged vascular endothelium. In the setting of vessel wall injury, platelets adhere to the exposed subendothelial collagen. Notice too the name on the field displayed on the wall. Platelet attachment to exposed collagen is strengthened when the platelet also binds to von Willebrand factor on the vessel wall. To do this, platelets have a special surface receptor designed to grab on to von Willebrand factor called glycoprotein 1b or GP1b. Well, just like a platelet must first adhere to von Willebrand factor before being activated, a batter too must first adhere to his bat before stepping up to the plate. Look closely and you'll see that we've sketched 1B onto the bat that this little leaguer is latching onto in order to get activated. Platelets have numerous surface receptors, but just let that 1 in the GP1B remind you of the first step in platelet activation, adherence to von Willebrand factor. Okay, once adhered, intracellular signals lead to platelet activation, which involves the synthesis and secretion of more platelet activating and platelet recruiting molecules into the local circulation. Home plate will be our recurring symbol for an activated platelet that's ready to degranulate. Think of it this way. On any other night, home plate is just a 5-sided slab of whitened rubber. But on game day, when the batter steps into the batter's booth, and you feel that palpable tension in the air as the pitcher winds up his throw, that, my friends, is what America's pastime is all about. And a fitting metaphor for an activated platelet, just waiting to degranulate and send one out of the park. And it looks like one of the players has gotten a hold of one now. Products secreted from platelet granules include adenosine diphosphate, or ADP, a powerful inducer of platelet aggregation. As the ball is released toward the first baseman, let those outfielders crowding the plate and jostling for position remind you of platelets aggregating. And as the sign on the wall behind them indicates, that glove open and ready to make the catch is a surface ADP receptor, specifically the P2Y12 receptor, as highlighted by the advertisement for youth ball at the bottom of the sign. Remember, ADP aggregates to platelets. Another molecule secreted by the activated platelet is serotonin, or 5-HT. Serotonin is that hormone that makes you happy. So our recurring sketchy symbol for serotonin is a smiley face, of course. this time incorporated into the helmet getting thrown, secreted if you will, by our activated platelet. Serotonin acts locally as a platelet aggregator and vasoconstrictor. And there's one more important molecule secreted by the activated platelet, and that's thromboxane A2, represented by the batter's box around the home plate. When thromboxane gets sensed by nearby platelets, it causes them to change shape, release their granules, and aggregate. So from now on, whenever we talk about activated platelets degranulated and doing their thing, just remember the thromboxane batter's box that the batter had to step inside of first before the plate is activated. It's extremely important to understand how thromboxane is synthesized because many of the antiplatelet and anti-inflammatory agents affect this pathway to some degree. So we've illustrated the thromboxane pathway here at the dugout. Thromboxane is synthesized within platelets by the enzyme cyclooxygenase, or COX, represented in this sketch by Coach Cox. Inside an activated platelet, COX initiates the synthesis of prostanoids, such as prostaglandins and thromboxane. Now, COX exists in two primary forms, COX-1 and COX-2. Think of these enzymes as head coach COX, COX-1, and the assistant coach, COX-2. COX-2 isn't active all the time. Instead, it's preferentially expressed at sites of inflammation, responsible for producing the prostaglandins that mediate the inflammation process. So in this sketch, we've left our COX-2 assistant coach in the dugout. Not only that, he's sleeping, inactive until some inflammatory event on the field requires his attention. Stay tuned for our anti-inflammatory sketch when we'll see how active the COX-2 assistant coach can get when there's some inflammation on the field. Our head coach, COX-1, on the other hand, is constitutively active. He is always on, managing his players on the field. COX-1 is involved in a number of housekeeping activities in normally functioning tissues, including the kidney, GI tract, and platelets. For now, let's focus on COX-1's role in platelet activation. COX-1 synthesizes the platelet-activating molecule thromboxane from a precursor molecule called arachidonic acid. At Sketchy, arachidonic acid will be abbreviated AA, depicted here behind the AA minor league dugout. Think of this AA minor league player on the bench as the precursor molecule, just waiting to be converted into an active player on the field by head coach Cox. And now's his chance! As Walter Matthau over here motions toward the batter's box, remember COX-1's role in converting arachidonic acid into thromboxane. Also, we've made our infuriated head coach twisting his red arterial hat in frustration, because thromboxane also acts as a potent vasoconstrictor. All right, from our discussion so far, you can probably tell that there are several molecules that antiplatelet agents can target in order to reduce the activation and aggregation of platelets, thereby preventing the formation of that platelet plug. The first drug on our roster, aspirin, works by inhibiting the synthesis of thromboxane. See the umpire here, yelling furiously at Coach Cox? Take a close look at that chest plate, and you'll notice that under the logo we've added the letters ASA, the acronym for the American Sports Association, and also a common abbreviation for aspirin. Whenever you think of aspirin, think of this aspirin umpire antagonizing Coach Cox after one too many cross remarks from the sidelines. Aspirin acts as an antiplatelet agent by irreversibly acetylating cyclooxygenase, thus halting the synthesis of thromboxane, that potent platelet-activating molecule. I want to emphasize a few important points here because aspirin is different than the other non-steroidal anti-inflammatory agents, or NSAIDs, that also inhibit the COX pathway. First of all, aspirin covalently attaches an acetyl group to the COX enzyme, thus inactivating it. To help remind you of acetylation, we've added our aspirin umpire's acetylation whistle. When he blows that whistle, that's it.